Family assessment, the Parent Trap family. Hello, my name is Morgan McVeigh, and today I'll be presenting a family assessment project using the Friedman Family Assessment Model as a guide. For course Nurse 332. The family I chose to assess is the Parker James family, which is based on the blended family structure seen in the Parent Trap movie. I selected this family because their story perfectly demonstrates the complexities of separation, reunification, and adaptation within the modern family system. Throughout this presentation, I will discuss identifying data, environmental influences, developmental stage, health functions, stress and coping, and conclude with the nursing diagnosis, plan of care, and a relevant Healthy People 2030 objective that connects to family health promotion. The Friedman Family Assessment Model, developed by Friedman and colleagues, provides a systemic way to evaluate a family as a social system interacting with its environment. It helps nurses identify family strengths, communication patterns, stressors, coping mechanisms, and health behaviors. This framework was ideal for assessing the Parker James family because it views the family as both a unit and a collection of relationships that influence health. By using this model, I was able to understand how each member contributes to the family's overall functioning and how external factors like environment and community impact their health outcomes. The assessment tool enables nurses to again discover the family's strengths and potential risks and interventions that may be required. Identifying data within the Parker James family. Members that were living in the home were Nick Parker, the father, 42 years of age, Elizabeth James, the stepmother, or the father's girlfriend, age 40, Hallie Parker James, one of two twins of the father, Annie Parker James, one of two twins, daughter of Nick Parker. The Parker James family is a nuclear family currently living in the movie Napa Valley, California. The family identifies as British American and practices a non-denominational Christian faith. They are considered to be upper middle class, with both of the parents maintaining professional careers and financial stability. I'm sorry, Elizabeth James is the real mother. She is not the stepmother or the father's girlfriend in the movie. The family's cultural background. The family's cultural background blends American and British traditions, which are reflected in their values in politeness, education, and communication. Overall, the Parker James family presents as well-structured and health-conscious, with resources to support their physical and emotional well-being. This genome displays 3 generations of the Parker James family. At the top are Elizabeth's parents, Mr. and Mrs. James, both in their late 60s. Her father has hypertension and her mother experiences osteoarthritis, two common chronic conditions associated with aging. In the middle generation, there's Elizabeth and Nick, who were separated for several years but are now in the process of reconciling. Their twin daughters, Hallie and Annie, form the youngest generation, both in good health. The family also has a pet dog named Bella, who provides companionship and emotional support. This visual helps identify potential hereditary risks and offers insight into the family's relational patterns and emotional connections. The Echo Map illustrates the Parker-James family interactions within the systems in their environment. The family has strong connections with their children's school, health provider programs, grandparents, and close friends. These relationships provide emotional and practical support. Moderate connections exist with their church and workplaces, which reflect limited time due to parental work commitments. The main stressor in the past was family's long-distance separation when Elizabeth lived in London while Nick remained in California. Since reuniting, the family has built stronger community engagement and improved communication. Overall, their external systems positively influence their stability and well-being. The developmental level of the family life cycle stage is a family with school-aged children, which is Duval stage 4. Justification, oldest children are 11 years old, which are school-aged. Parents focus on education, moral development, and social skills. Reintegration after parental separation means rebuilding structure and stability, while supporting children's autonomy and maintaining guidance. The family's strengths will be stable financial and emotional resources, strong sibling bond and parental cooperation, emphasis on communication and education, but the challenges will be adjusting to new routines after reunification, balancing work-life responsibilities, maintaining consistent communication. Environmental data. The Parker-James family resides in a large vineyard home surrounded by nature in Napa Valley. The environment is safe, quiet, resource-rich, offering excellent schools, healthcare, and recreational opportunities. The family maintains a clean and organized household, reflecting pride and structure. The family value eating, enjoy cooking meals together, and engage in outdoor activities. Their pet Bella contributes emotional comfort and reduces stressors within the home. The overall environment supports the family's physical, emotional, and social well-being and promotes stability and resilience. The Parker-James family demonstrates excellent health-related behaviors. Both parents emphasize preventative care, maintain routine medical and dental visits, and encourage physical activity. Health decisions are shared between both parents, and children are up to date on immunizations and routine screenings. The family also practices strong communication with their healthcare providers and uses private insurance. Emotional wellness is supported through family bonding, open conversations, and maintaining healthy routines. As nurses, our role would focus on reinforcing emotional health, encouraging family communication, and preventing stress-related illnesses. Parker-James family has experienced significant stress in the past due to prolonged parental separation. Secondary stressors include work demands and distance from extended family members. But despite these challenges, the family has demonstrated strong coping mechanisms such as humor, open dialogue, and counseling. The children share a close sibling bond, which enhances family unity. Parental Parental cooperation and structured routines have contributed to positive adaptation. Today, the family exhibits emotional stability and an improved sense of togetherness. The primary nursing diagnosis for this family is interrupted family processes related to prolonged parental separation, as evidenced by communication barriers and emotional strain. The goal: the family will demonstrate improved communication and emotional reconnection within 4 weeks. Interventions include facilitating family counseling sessions to enhance parenting, encouraging regular family meetings to express feelings, teaching stress management and active listening techniques, promoting shared recreational activities to build connection, and assessing progress and adjusting interventions as needed. These actions will support the family's goal of restoring emotional unity. The Healthy People 2030 objective most relevant to this family is reduce the proportion of families that experience difficulty paying for health care. While the Parker James family does not currently experience this issue, this objective reinforces the need for equitable healthcare access for all families. It also highlights the importance of mental health and family counseling resources to strengthen relationships and resilience. This aligns with nursing advocacy to promote holistic family wellness, physically, emotionally, and socially. In summary, the Parker James family is a strong, loving, and resilient unit that overcame challenges of separation through communication and mutual respect. These are my references, and I thank you for taking the time out to listen to my presentation on the Parker James family assessment. As nurses, it's vital that we assess not only physical health, but again, also emotional and environmental